Hi, today we're going to talk about tennis elbow or lateral epicondylitis. So that is basically an inflammation of the lateral epicondyle of the elbow, which is this bony part on the outer side of your elbow. So there is a set of muscles that originates here, which are collectively called forearm extensors. So you see this bulk of the muscles, so this heads down this way and then splits into four parts and goes into these four fingers in the form of these ropey tendons, and it goes and controls the fingers, the wrist, and the elbow movements and the forearm movements as well. So these are the muscles that we're going to be stretching when you have a case of tennis elbow or lateral epicondylitis. So before we move on to the stretch, just a few instructions. Every stretch that we're going to do, you can hold for hold for about 5 seconds and then gradually work your way up to say 7 seconds, 10 seconds, 12 seconds, and so on. So you can go up to a maximum of about 20 seconds, but I mean, it's totally up to your tolerance level, and how much you can progress totally depends up to you. Whenever you're stretching, it should not be painful. You should only feel stretchy. So for example, when I'm stretching, say my wrist, I feel, oh, this is painful. So what I need to do is maybe stretch a little bit less. So say I'm at here I'm at a 90-degree angle. So if this is painful, I would stretch only say 85 or 87 degrees. So it should never be painful. It should only be stretchy. The other thing is, because we're going to be working on these muscles here, make sure that your shoulders are relaxed. So the shoulder tips are back and down and not up like this or tensed at all, and your neck is also completely relaxed. Your neck is not holding any tension during these exercises. Now the first one we are going to do is the stretching of these muscles. So I'll show you on the side. So basically what you're going to do is, with your elbow extended, you're going to bend your wrist down like this. If this is comfortable, then what you can do is make a fist. So you can make a fist with your thumb on the inside, and this is what you're going to do. With my other unaffected hand, I'm going to give an overpressure to this affected side. So this is one exercise. You're going to hold, say for example, if you're doing 5 seconds, hold for about 5 seconds, 1, 2, 3, 4, 5, and then relax. The second one is similar, however in that we are going to bend the elbow. So this is going to be bent and not extended out. So I move back so you can see. So this is what you're going to do. Now the hand, you realize, is at the chest level and not at the neck level, because the moment you do this, again, your shoulders are gone up. Yep, so you want to avoid that movement. So your shoulders are nice and relaxed, your neck is nice and relaxed, and what you're going to do is, suppose it's my right hand, which is right side that is affected, right elbow. So I'm going to push, you see this, I'm pushing in with my left side. So push in like this. So it's the same stretch as the first one, however your elbow is bent at a 90-degree angle. Moving on to the third one, the similar stretch can be done against a wall. So I don't have access to a wall here. So what I'm going to do is just demonstrate. For example, if say this is the wall, what I'm going to do is this against the wall. I can even make a fist, but it's more comfortable to do it this way. So again, holding the stretch there, feel the stretch, and you feel the stretch along the forearm. If you are tight along your triceps, the whole extensor chain right from your shoulder to your wrist, you will feel it along your triceps as well. The fourth exercise we are going to do is the rotation. So what you're going to do is, you're going to rest your forearm along a pillow or a hard surface or a table, so like this. And if you can see, I'll show you this way. So suppose you are resting here. Yeah, so you see, this part of my arm, the darker side, this is the darker side, this is the lighter side. So the darker side of my forearm is facing upwards. So what I'm going to do is now turn it around so that the lighter side of my forearm is facing up. So if I was to show you, it's like your arm to forearm is 90-degree. This. It seems quite simple. However, when you have lateral epicondylitis, sometimes it is very difficult to get this flat. So you'd either be here, or when you're turning, you'd be here. You won't be able to go all the way flat. Now the last exercise we're going to do is a stretch for the triceps. Now in this we have to be careful not to strain your neck at all. So it's a simple stretch. So basically your arm is in line with your torso. You can either give an overpressure like this, but sometimes you tend to stiffen your neck. So what I like to do is push back with my other free hand. I push back around the lower end towards of my triceps, so towards the back. So pushing this way towards the back. So this is a good triceps exercise. Now to make sure that your neck is relaxed, what you're going to do is you can just move your neck around just to make sure you're not holding any tension there. You're not doing this, your shoulders back and down again. So this is a triceps stretch, a simple one that you can do. So basically these exercises are aimed to stretch out the extensors of the forearm, the wrist, the fingers, and the triceps as well. Hopefully these exercises will be helpful for you. For further details on why you get lateral epicondylitis, what are the signs you can look at to know if you do suffer from lateral epicondylitis or tennis elbow, or what are the other tips and tricks that can help you overcome this condition or ease out the pain and inflammation associated with this condition, join my Facebook group where we discuss these topics in more details. The link is in the description below.